Big breaths in.
At this Ontario emergency room, this doctor is seeing more cases of walking pneumonia.
I have diagnosed more pneumonias this season than probably the last 3 or 4 seasons combined.
The bacterial infection usually doesn't wipe you out. That's why it's called walking pneumonia, and symptoms are similar to most other respiratory viruses.
There's fevers and chills and cough. Those would be the obvious one. Sometimes there can be chest pain associated with it. Specifically to atypical or walking pneumonia, sometimes there's GI symptoms, so nausea, vomiting.
But the most vulnerable can get serious complications, and more Canadians than usual are getting infected. Quebec and British Columbia have seen a rise in cases. And one Halifax hospital says it's already seen more than 100. Last year, there were just 11. In Newfoundland, a mask mandate is back in health facilities, partly to stop the spread of the bacteria responsible for the illness.
We're trying to get ahead of the surge of respiratory illness.
There's a spike in cases in the US, too, most notably among kids between 2 and 4. Those kids rarely get this type of pneumonia. We don't know why there's a spike, but doctors say it is highly infectious, and people can be contagious for weeks before they show symptoms.
If somebody has mycoplasma in a household, you can expect 1/3 of the household to get it.
Antibiotics are effective, but patients need the right ones. And those don't include the standard penicillins, like amoxicillin.
Well, that's an excellent antibiotic. It doesn't work for mycoplasma pneumonia. We use a different class of antibiotics.
Doctors say there's also a good chance your immune system will be able to fight off the infection on its own. But if you can't seem to get better, or you're having trouble breathing, the message, don't wait. See a doctor. Jennifer Yoon, CBC News, Toronto.